You and I have talked in the past about integrative medicine. We're both fans of it.
Sure.
We both believe that there's some fun, unique solutions out there that just pharmaceuticals don't always provide, right? Fair statement?
Fair statement.
Okay. I learned through doing a lot of work with integrative doctors how each tooth correlates to an organ or a part of the body. And do you know how hard it is? Okay, let me back up. Do you know how hard it was for me to accept that? It took me a while.
Okay.
Because I'm sitting there and I'm going, what? Really? And, I'm starting to, and had I not had the exposure to these brightest minds I've ever met on breaking it down for me so a layman like me can understand that. I mean, I'm bought in. I believe it. I do believe that. So, but, I mean, quite frankly, you and I are less on the fringe than used to be, but still a little on the fringe, agreed? When it comes to the integrative?
And it's coming more and more. I mean,
it's a lot less
people
than
are getting it, yeah.
Right? And so you're talking about building in that relationship or that communication, education to both patients and clinicians. Do you have any ideas or suggestions on how that's going to transpire? Because it's a paradigm shift. You agreed? There's a paradigm where most of America was taught, go see your doctor. He's going to write you a script for whatever ails you, and you'll go on your merry way. Versus looking at the total, comprehensive mouth, physical, emotional, how powerful the emotional side of things I've learned on. And so how do you have any suggestions or thoughts on how, because I do agree with you on that improvement on how we can make strides in that.
So a couple thoughts. One is educating patients on the connection, right? And helping patients understand what the objective is when they come in every time. It's not just to clean your teeth. It's to measure on a regular basis your level of health. How healthy is your immune system? Most patients are not aware that you can measure what's going on in your mouth is a measure of the health of your immune system. In your total body. So your hygienist should be able to give you a reading, give you some feedback on the overall health of your immune system every single time you go into the practice.
Do hygienists know how to do that? I mean, that's the thing. I know you're smiling like that because they don't, right? I mean, most of them don't know how to. I've never been into a hygienist appointment and them talk about anything other than my size of my pockets and try to deep into them. So I'm kidding.
Right?
But yeah, I mean.
But it's the correlation. So what does that mean? So if you have 4 and 5 millimeter pockets with bleeding and infection, what does that mean to your overall health?
Can't be good.
Can be good, but how is it correlated?
Exactly.
What do you do about it? What does it mean? All of those are all topics of conversation.
So that's additional homework I need to do of find some experts to bring onto this to let them help train so that now we got some additional tools for patients to know to even ask.
Correct.
And clinicians and hygienists.
Yeah.
This project keeps getting bigger and bigger.